In Nigerian hospitals, the front line is under strain as doctors demand the return of the dismissed colleagues and the long-overdue support from the government. Dismissals and unpaid salaries are not new in Nigeria. Over the years, medical workers have faced suspensions or sacking for advocating better working conditions, pushing many to seek opportunities abroad. Between October 2024 and August 2025, 5 doctors at the Federal Teaching Hospital in Lokoja were sacked, leaving them without work for over a year. NARD warns that such action are fueling a growing crisis across the health sector.
We have 5 colleagues in Federal Teaching Hospital Lokoja who were unjustly terminated. These colleagues were in the heat of leading the association, fighting for welfare issues when they were terminated. One was the ARD, local chapter ARD president. One was the local chapter vice president. One was the local chapter secretary. One was a member of the welfare committee. And one was a past ARD president in that center. And incidentally, he is also the immediate past chairman of the entire doctors of Kogi State. So one begs the question: what degenerated down to terminating these appointments? I think relitigating it might not look well for the government. I think the best solution is just to reinstate those people and ensure that they are back at work, especially in a center where you have 89 consultants and only 32 resident doctors. We all know resident doctors are the backbone of healthcare service delivery in our tertiary healthcare facilities.
Dr. Suleiman is urging the federal government to reinstate dismissed doctors and pay long overdue salaries and promotions, warning that failure to act could escalate into a national health disaster. While NARD remains open to dialogue, the call is clear. Urgent action is needed to relieve overburdened doctors and prevent a collapse of Nigeria's fragile healthcare system.
We have one particular challenge now in this country. That is excess workload, burnout from doctors. What is that excess workload? What is that burnout? For instance, in my unit, I am a senior registrar. I have 2 residents. Now, you're supposed to take calls. Now, a doctor can come to work 8 in the morning on a Monday. You work till 4. You're on call. You take that call until the next day, 8 o'clock. You continue working as per normal regular civil service till another 4 o'clock. If you're on call, you continue again. In most hospitals in Nigeria, you find doctors taking this kind of calls, 24-hour shifts, 32-hour shifts, continuously, some for months, some for weeks.
As negotiations continue, the nation watches closely, hoping for solutions that safeguard both healthcare workers and the millions who depend on them. Sydney Okafor for Anchor News.